Good morning. My name is Rikard Moen. I'm the Chief Medical Officer of Optima Health, and today I'm going to be talking about sleep disorders and fatigue, but with particular relevance to the workplace. And that is why the one key message coming out from my talk today is fatigue risk management and fatigue risk management systems, which is a key part of any industry. So, what is sleepiness and fatigue? Definitions are always important. You will see some of the definitions there. Importantly for fatigue, it's the inability to conduct a task. Now, whether that's being underloaded or overloaded, that's not the issue. And that's very important within the workplace from a safety point of view, but also not just in safety critical industries, but in many, for example, your CFO or in the banking sector. People can make business critical, financially critical decisions. Always remember that the risks to an organization are PEAR, people, environment, assets, and reputation. So it is not just train drivers and people who climb up heights. Well, is it really that important? I mean, we all go to work, we feel tired, we feel sleepy. Well, yes, it is. I mean, there's just a snapshot of some of the examples that I've had to deal with during my career, and all of those have resulted in multiple fatalities. And the key message, each of those, the causative factor was fatigue. And this goes on a regular basis. Whenever you hear of car crashes on the motorways, it's invariably 0500 in the morning, and it's usually a truck driver or a car driver. That's when that is the most sleepy time of day. But I'll be touching upon that. Two parts today, going to touch upon fatigue, just sort of run through what fatigue is rather than sleep. You're going to have some other presenters on sleep, so I'm going to focus on fatigue and then how to manage that within the workplace. Again, why is it important? Well, as I've mentioned, performance, incidents, accidents, fatality, and there's some really scary statistics that 57% of truck accidents are related to fatigue. And fatigue is a steady decline, progressive decline in being alert and being able to perform your duties safely. So it doesn't happen immediately. There is a gradual, which from a hazard management point of view does, in theory, should make life easier to be able to manage. But because there's a huge amount of behavioral safety and personal safety within this, it's really education and the responsibility of your workforce is a very important part of it. And you'll see there, we've all experienced that, driving late at night and a dark lit motorway, that scary moment when your eyes shut. That is one step away from a disaster, as we all know. And it's all in the mind. Well, literally, it is actually. And if we're able to control and keep our mind awake, then no matter how dangerous or serious your job, you can always do it safely. We've all heard about the circadian rhythms, but that's an important, in fact, not just important, a critical part of fatigue and sleep. When we live in a circadian, everything we do, whether it's eating, sleeping, bowel motion, anything is linked to our circadian rhythms. And you can see there the various parts of day that physiologically your body adapts to that. And your lowest part of the day, well, there's 2 points. There's the afternoon lull, and then in the middle of the night is when you're at your coldest, and your pulse and blood pressure are at the lowest. And this is what Fitbits and all these smartwatches, this is what they're measuring when they're monitoring you from day to day. And there we see the circadian rhythm in sleepiness itself, and as I touched upon, there are 2 peaks essentially in the day, and those are the time that you need to be most careful and you are most at risk. A key influencer is a thing that is called the Zeitgebers, and there are many Zeitgebers. Light is probably one of the most important one. So when we're looking at shift management, workplace management, working at night to make sure there's brightly lit lights of the right frequency to help keep people awake is a fundamental part. Eating is a Zeitgeber. All the things that we do within that circadian rhythm our Zeitgebers that influence our body clock. And I say light is a key part of that, because your hormones are generated by those Zeitgebers. And as I mentioned there, that timing of light exposure, and we've used this in oil and gas, where we actually give artificial light to our shift workers coming on or going off, but particularly coming on shift. And we'll all have jet lag. Well, jet lag is different to this sort of fatigue, but obviously very much linked. And you can fool your body. When we travel, we do that. We put in earplugs, we put on face masks, and we sleep when it's supposed to be day or at night time. And casinos are a very clever way of playing with your Zeitgebers, because they constantly feed you, they keep the place dark, and you have no idea, and your body has no idea what time of night it was. And your alarm clock is a Zeitgeber that impacts upon your circadian rhythm. And one of the ones that's influencing all of our lives at the moment, with the flashing blue lights at night and emails coming in and text and social media, is having a huge impact upon our domestic creation of fatigue within our lives, and that does impact upon work. So mobile phones is a very important factor in all of this. Cognitive impairment as you become tired worsens, as you can see in the graph there. And after 16 hours of not having slept, a lot of here have been house officers in the hospitals or been working long shifts over weekends. After 16 hours, it's the equivalent of having had 2 pints of alcohol. That is your cognitive impairment. Now, would you allow somebody to drive a truck, operate on you in the middle of the night if they've had 2 pints of alcohol? Of course you wouldn't. So that is why this is an important risk mitigation that we need to deal with. And how do we deal with this risk mitigation? Well, the first step is what we call a health risk assessment. You have to look upon fatigue. It's a hazard. It is a known hazard, foreseeable hazard. What's its likelihood? So when it comes to health risk matrix or any risk matrix, it's likelihood versus consequences. So what's the likelihood of being fatigued? Almost every job, the likelihood is high. What are the consequences? Depends upon what you do. But that can potentially be way up there in the 5-5 top zone. And near misses are directly correlated with fatalities. We've all seen the safety pyramid. But important to remember that for every 600 near misses within our workplace is equivalent to one fatality. And that's a scary statistic, an important one to take away from today. So fatigue, I always say regard it as a near miss. If somebody is fatigued, that could have been a fatality, and if there's enough of them, eventually it will be. And again, here's some examples of incidents that have occurred. The one in the middle you might recognize. This is GNER back in the early 2000s, when the Land Rover driver with the trailer drove off the bridge onto the rail track because he fell asleep while driving, and unfortunately the 125 drove straight into him onto the other line, onto an oncoming freight train. And major serious incidents, that's how things tend to happen. There tends to be a sequence of events, but the ultimate causation of that was fatigue of the driver of that vehicle, and obviously he's had to live with those consequences ever since. What specifically are the kind of disorders that correlate with this? Well, there's a whole myriad of disorders. Many you see there that we all know about narcolepsy, we all know about sleep apnea, restless leg syndrome. There's a multitude of disorders that are disorders that impact upon safety, not just fatigue. But even without any of these, fatigue on its own is a significant risk factor. And here are some medical conditions that on their own can cause fatigue, and a whole list. And some of the very important ones, and certainly us in the safety critical industries, the medications and drug and alcohol are very important. So long-term fatigue, what are the health effects? Well, you'll have all seen the research studies coming out of Denmark on breast cancer within shift workers, and from the aviation industry, where there is a potential link between shift work and cancer. And the IRAC has actually linked it to shift work based upon these studies. but diabetes, cardiovascular disease, high blood pressure. These are because your circadian rhythm and your body system, when it's fatigued or when it's working shifts, is not consistent and is all over the place, and that plays havoc with your body. You know, if you mess about with your circadian rhythm, you do mess about with everything else. And there's and psychological illness, mental illness is a hugely important one, as is pregnancy. People sort of forget that fatigue on top of pregnancy, is not a good mixture. So fatigue in the workplace, very important, known hazard. We know how to mitigate it, and that's what we should do. What in the workplace can cause fatigue? Well, we touched upon the shift work, long hours, rapidly rotating shifts. When those shifts are timed, whether it's a night or day shift, whether it's a slow or a fast rotating shift, whether it's forwards, backwards, the type of work you do, obviously, if you highly physical work, you are going to become more exhausted, and if you're working in harsh environmental conditions, that does have a hugely direct impact upon what you do. Also, the scheduling of your work, whether it's either mentally or physically demanding. If you're underused or overused, pushed too hard. Travel, never forget travel. When I worked at ExxonMobil, if you had traveled overnight, more than an 8-hour flight, you were not allowed to drive your car the next morning. You had to make sure you got a taxi or organized transport, because many incidents and fatalities were as a result of that with business travelers. Don't forget what you do outside work. People think, well, the work will look after me. Well, actually, you have a responsibility to come to work healthy and fit for work, and really, family, as if you're especially working night shifts, the impact from your family, for people to understand that dad's been on night shift last night. That's why we have to be quiet and make sure that he sleeps, because if he doesn't sleep, he'll be fatigued and could actually put himself under risk. And that was one of the things that was learned at the Croydon tram incident, was very much the link between all of that, between an employee's well-being and their fatigue. And remember, alcohol doesn't help sleep. It actually disturbs your sleep pattern. And these are the sort of effects that it can have on the employees. I mean, there's nothing there that we're not already aware of. But I think one of the key ones that's harder to control is it does increase risk taking. It reduces judgment, so you have poorer judgment, not just at high speed or high activities, but actually in anything that you do. So financial people, working in the markets at 4 in the morning is probably not the best idea, and accidents happen, incidents happen. Touch again upon shift patterns. I mean, it's so fundamental, because if you are pushing someone on a shift pattern that is against their circadian rhythm or doesn't help their circadian rhythm, then you're not helping the situation. So the key message: there's many different kinds of shifts, but avoid the rapidly rotating shifts. It should be a minimum 7 days, and it should always be 2 nights full sleep. This is what we call the sleep debt between those shift patterns. Should be forward rotating, not backward rotating, i.e. day, night, rather than the other way around. Or if you're doing lates, it should be early, late night, not the other way around. It's a disaster the other way around. And this is what I mentioned, is the sleep debt. And there you can see, basically, the higher the curve, the more sleep debt, the more dysynchrony you have within your sleep. And you can see there that the dark purple is 7 nights, 7 days. So you start to acclimatize on nights, then all of a sudden you go to days, and then you see your sleep debt that you have there. And then the thin black line is 7 days and then 7 nights. So you see it's similar. The best one obviously is full normal days, but even there you gradually get tired, fatigued, develop dysynchrony, which is why you need to take your weekends if you can, and you certainly need to take your holidays. That will continue to rise, which is why it's so important for people to take their holidays. Many strategies can be used to try and help this within the workplace, and this is fitting within your fatigue risk management system. I've touched upon most of these already. Temperature is important. If you make a room dark and nice and warm, we all remember when we had radiology lectures at 2 o'clock in the afternoon, 2/3 of that room was asleep within 15 minutes. So these are the Zeitgebers that manage the hazard. The sort of hazard mitigation are things that you need to do. Regular breaks, So this is the system that within an organization, and if you don't have this within your organization, and you are in particular safety critical or a shift driven system, then it's absolutely fundamental and critical that you have this. I'm not going to go into a huge amount of detail other than really to give you an overview what it is. Perhaps next year I can actually speak specifically about this, but it is like any health and safety system. It is a system with its policies, with its mitigations, and there's many parts to that. And here we see in a complicated graph, really, the practical application of that is like all of these things. You review, you evaluate, you then create your governance structures behind it, your policies and standards and procedures reinforcing that. But then at the very top sits your policy. So it starts at the top and it works its way down. Many organizations start at the bottom, but you've got to start at the top. If you're developing any form of workplace safety system, or really any system within the workplace, then whether it's a health management or safety system, you've got to build from the top rather than piecemeal. If you don't have a workplace fatigue policy, no matter what your organization does, it is something that you absolutely should have. The HSE would expect you to have it. It's certainly something that you should have in place, where you assess what people do and how you're going to protect them within that. How long are they driving for? Commuters, if people are commuting long distances, adjusting hours of work to reduce traveling during commuting. An important part of this is whether you have drug and alcohol testing within that. And these tend to be the sections within that process. I'll just let you very quickly scan through, and there are many documents that can help you create this. But it is one of the important things is that you evaluate the system, like all of these things, like all these management systems. You evaluate the system. So therefore, any near misses, any incidents and accidents that occur, if you're not measuring them and not learning from them, then the whole system fails. I mean, it's a bit like audit. It's that cycle. And here's just one of these, which you will be aware of, that can fit within that. And this is part of the screening part of it. So this is the monitoring part. There are more, like any form, like the hierarchy of control. There are things that you should try and do before that. And substitution and adjusting the risks, and there are lots of technologies out there. There are numerous kinds of monitors that can be used within the workplace. You'll see the bottom right there. On the trains, they have a dead man's handle and a pedal that you have to keep pressing to check that you are still alert. And there's a Guardian system, which I'm going to touch upon, which is a really interesting device. So here's a thing they call the smart cap. So all of this is basically measuring the individual, different ways of measuring an individual's fatigue and trying to pick it up early, linked to technology and an alarm system to help warn that they are getting tired and they need to. This can either be within a helmet or, as you see, even within a baseball cap, and just alerts centrally, people in central control, but also the individual as well. And this is a very clever device that is used in numerous transport industries. This is within the cab of whether it's the bus or the train or the tram, and it monitors the patient's face, as you can see there. So it is monitoring, and it's just looking for the signs of fatigue, eye blinking, nodding, make sure that there's head movement in the appropriate ways at regular times, and it's recorded centrally. And you can see there to the left that it is being recorded. And interestingly, one of the companies that I looked after, when they put in this system, 50% of the micro sleeps that their drivers were having, drivers didn't even realize. They hadn't detected it themselves, but the system had. So I mean, that's. And interestingly, within that organization, when they started looking and started tackling their employees, they made it a no-fault policy. This was designed to protect them and protect their passengers, and it was a very positive approach to fatigue and how to manage it. They were discovering that people they weren't sleeping at night, or they were working early, but they were still going to bed at midnight. And it very much turned into a well-being program. So what started out as the result of a serious incident became a fatigue risk management system with this sort of monitoring and all the things that I touched upon previously. And then as a result of that, with what they discovered, they then created a well-being program from that to help the employees with their well-being. And here's just an example of Mr. Smith or Mr. whoever on the left. You can see how wide his eyes are. So that's because of an early warning that he's trying to keep himself awake. And we've all done that. You know, we open our eyes, we open the window, and then to the right there, he has fallen asleep. The system immediately sets off an alarm to wake the individual. It's monitored centrally so they can then have a discussion with the employee, just really to talk through, how did that happen. If you are looking for reference materials particularly on implementing a fatigue risk management system, I would strongly urge you to go to OGPI PICA and go to the fatigue risk management systems that we have developed there. So OGPI PICA, led by David Flower. David Flower, as you will all know, is very much the guru on fatigue. And there's some great documents. If there's any way you want to start, if from today you're saying, oh dear, no, we haven't got any of that, I would pull out this document. It tells you what you need to do and how you do it. More importantly, the second version helps to tell you how you need to do it. So that's a very whistle-stop tour of fatigue, sleep within the workplace, the mitigations that you need to implement to protect yourself within the workplace, and happy to take questions in the question session. Thank you very much.